Thank you. Hey, Miss Mazine, please like, invite. All of us have an athlete within us. We're all athletic, believe it or not. I mean, we don't think about it. Hey, Auntie Diana Brown. Hey, thank you for joining on. Please like, invite, and share as you guys come on. We're going to allow you guys to pile on and please invite your friends and family and business partners, whomever else you're linked from LinkedIn. I invited people from LinkedIn. I'm also simultaneously live streaming on YouTube, so it'd be greatly appreciated if you guys would let people know about me. Yes, Dr. Grace. I am a MD, medical doctor. Yes, for over 20 years now. I'm in the Metro Detroit area, and I'm managing owner of Everything New and Bethesda Holistic Center, where we bring the medicine and alternative modalities to you wherever you may be. There's no state, there's no one that is too far or too near that we would provide services for. So please go to www.bw-center.com /mm for the for Medical Monday for the free download. Please, we really take our time out to put things together. Hey, Tanisa, please like, invite, and share as you come on. I appreciate you watching. And get that information and read it. And if you have questions, we can address it tonight. If you know any personal trainers, tonight we're going to be talking about information that is going to be vital to them and their and what they do as far as training people on a from personal trainers have should have a wide clientele from the average day person who wants to work out and be healthy to probably professional athletes. And if you know any personally any athletes, invite them because I have some important information about some product line that is what we call um, it's called Informed Sports Certification. And I'll be talking about that a little bit later. I'm going to be talking about protein pacing tonight. I don't know if any of you have heard that before. Hey, Debbie, thank you for joining on. Please like, invite, and share as you come on. Um, we're going to be talking about that tonight. Hey, Doris, thank you. Thank you. You're so faithful. Thank you for being on every Monday. We appreciate you. We're also thinking about doing a 30-day challenge. Yes, as far as health maintenance or getting your health where you want it to be. So if you're interested in that, please get in touch with us because we want to form a group and so we can have some type of accountability. So if you guys are interested in that, please message us. So our business is in Southfield, Michigan at 21411 Civic Center Drive, Southfield, Michigan 48076. And our telephone number where we can be reached is at 248-356-1111. That's 248-356-1111. Hey, Marvin, thank you for joining on. Please like, invite, and share as you come on. It'll be greatly appreciated. Hey, Tawana, thank you for joining on. Since you've been coming on every Monday. I really appreciate that. Hopefully you guys are sharing my videos with everyone. I try to upload them. Well, I don't have to upload them. They're on our Medical Monday page. We try to save them, and I'm simultaneously live streaming on YouTube. I need to download Instagram on my other device, so I can also be doing that on Instagram simultaneously as well. So please like, invite, and share as you guys come on. I'm gonna get started in a few more moments here. We're gonna be talking about keeping your body moving, which is very important in maintenance of your health and for longevity. And we're going to be talking about it from an everyday kind of thing and all the way up to personal and professional athletes. And for personal trainers and doctors out there, you need to be teaching your patients. We normally talk at our patients, yes, because we're in such a rush. Most oftentimes, this is what you need to do. The medication, if you meet this criteria, this is for you. No, we actually design services are tailor-made, specifically designed for you. And even if you're listening tonight and you're a personal trainer, I'm quite sure you do that. That's why it's called personal training. You should be developing your workouts and your products based upon what your clients need. So go to www.bw-center.com. That is our website, www.bw-center.com/mm for Medical Monday. I also want to put a shout out there to let you guys know that I'm available for speaking and teaching. So if you're interested, if it is be a church group, be it church, be it at a group of women, group of men, whatever you need, other providers that are interested in what I do as far as alternative medicine along with allopathic medicine. I do believe that they both can work together synergistically, and when to use it, when not to use it, and what can you educate yourself and your patients for them to be the best the best that they can be from the inside out. So we also do anti-aging. We also do athletic and performance, which I'm going to be talking about tonight. We also do energy, and we also do weight management. Hey Maria, thank you for joining on. Please like, invite, and share. So those are the four top things that we like to talk about because it covers everything. How many of you have said, "Boy, I'm tired"? Why are you tired? And we have modalities and testings that allow us to find out what is the reason for that. So, or why can't I release the weight that I desire? Those type of questions people may have. What can I do to stay as youthful and as youthful looking as long as possible? We also provide information and tools for you to do that as well. And so let's get on to the topic tonight. It is 8:09, and I have a lot of information to cover as always. So one of the things that I want to talk about tonight is we are designed and created to move and to be active, to dress and keep the garden. We can just start there. Yes, God created us never to die, but for whatever reason, man decided that he wanted to be disobedient, which threw us into a realm of aging and dying and death and disease. So what we need to do now is to allow ourselves and educate ourselves to allow us to be the best we can be from the inside out. So, mind clarity and mindset is number one. Hey, Lanita, thank you for joining. Please like, invite, and share as you come on. It's very, very important. Most oftentimes, if our mindset is not right, nothing else seems to fall into place. So you got to make sure that you have the thinking and the thoughts. I've done a series on this about mindset in one of my videos, and I'm just going to recap that. There you have over 60 to 65,000 thoughts a day. 85% of them are no, it's 95% of them are negative and 85% of them are repetitive. So what are you doing to combat negative thoughts? So most oftentimes negative thoughts, when you have a negative thought, your brain creates cells to release chemicals that are negative to the body that creates free radicals, which causes death, disease, and disease in the body. So your mind is very, very important that you have clarity of mind and clarity of thought and positive thinking, because just as the negative thoughts create cells that create chemicals, so those positive thoughts create brain cells to create chemicals that allows the body to be youthful and stay healthy and disease free. So we need the majority of our thoughts to become to be positive thoughts. And believe it or not, walking, yes, walking can cause clarity of thought. So it's very simple. All of us can walk. Even let's just say worst case scenario for some of those of people that you may know that are maybe bed bound or wheelchair bound or whatever the case may be. They're still mobile. They can still move their body to keep the circulation going, to keep their mindset and the blood flowing, and for them to have a good mindset and thinking and thought. What we do at Bethesda Holistic Center, we also treat people that are sick and shut in, elderly and disabled. And as we come in and make our mobility evaluation, we also can put modalities in place such as physical therapy and things of that nature to help people in the home, because not being able to get out can be stressing and trying on the mind and definitely on the body. I have a patient that I was talking to today. She a gunshot victim. She's a young lady. I think she's like 34, and I'm working with her in regards to getting her physical therapy and things of that nature. And being that I think she's a gunshot victim 6 years now, and she doesn't have any bed sores or breakdowns or anything because she does her best to stay positive in her thinking and her thoughts and mobility and keeping mobile. Hey, Doreen, please like, invite, and share as you come on. So, keeping your body moving. Do you guys know how much you're supposed to do physical activity above and beyond your daily activity daily? Because I hear this a lot. This is what I hear. I work at the plant and I have physical activity at the plant. Does that count? No, it doesn't count. That's your daily activity. That's your daily regimen. You're supposed to do at least 30 minutes above and beyond of your daily activity. Yes, 30 minutes. And guess what, guys? It doesn't have to be all at one time. So during your breaks, if you guys, those of you who have jobs and have lunch, may have a 30-minute lunch and two 15-minute breaks, you can incorporate your walking 15 minutes at a time. I don't know how you want to do it or whatever, but just 30 minutes a day is what is daily required. And it could just be 5 days a week. It doesn't have to be 7 days a week. This is what I tell people too. You can over exercise. And you're like, that doesn't sound right. Yes, you can. Because you can over exercise and get your body into what we call a stress state. So for those of you that are personal trainers, doctors out there, anyone that is in the health field, a person can be in a stress, put their body in a stress state where they secrete a chemical called cortisol, which can prevent them from releasing the weight like they would like because the cortisol levels are too high. Um, cortisol is a stress chemical or stress hormone. So it can cause a person not to release the weight like they like. It causes abdominal belly and fat. Increases adipose tissue, which is a nice way of saying fat. So for those of you that are personal trainers out there, if you have a situation where you're working with someone and you're like, you're not seeing it, of course, I'm not talking about the plateau phase. That's something totally different. I'm talking about if you're working with someone and they're on a meal plan, they're doing everything, and then they may be doing a little bit more outside of the time that you are working with them. So that needs to be addressed. And you need to get in touch with me to find out how you get those cortisol levels down because it could be some deficiencies there, and it could be some things that they need. Once that cortisol level goes up, the body needs to have certain chemicals, certain enzymes in place to break that cortisol down, to bring it back down where it needs to be. So believe it or not, chronic stress is anything over 36 hours. Chronic stress is anything over 36 hours, but that's a whole nother story. Let me get back where I'm going. Let's talk about why it's important to keep your body moving for mind clarity, for your heart, for breathing. Yes, getting your respiratory tract, keeping it on track. Yes, and your digestion. Digestion is very, very important. Exercise help with your digestion. One of the things that I want to talk about, I'll get into that in a minute. Stretching is very, very important in that. And your joints, keeping your body moving helps with keeping your joints strong and also help keeping them from degenerating, which could be part of osteoarthritis and versus rheumatoid arthritis. Those are two different things. I probably need to do a show about that. So I could probably do a whole show on osteo and rheumatoid arthritis alone about joints. But keeping moving helps decrease your, as my mom said this to me. Yeah, when I was coming up, they called it rheumatism, baby. Haven't you heard of rheumatism? Okay, I've only been a doctor for 20 years. Yes, mama, I've heard of rheumatism. I love you, mama. But anyway, that was just today. She said that to me today. I thought that was so cute. But anyway, the proper way to get your body moving. You should never do any type of activity without stretching first, without warming those muscles up first, because it decreases your risk of injury. And you should also stretch after you work out. So before you start walking, Make sure you do some type of stretching or whatever. Stretch those, stretch those hamstrings, stretch those knees or whatever. Do a couple of squats or whatever before you even start walking. And then afterward, you got to make sure that you do some type of stretching, which would decrease the risk of injury. Okay, make it fun. Don't do anything, believe it or not, as a mindset thing, right? I know it's a lot of people like they're out there. I don't like exercise. I hate exercise or whatever the case may be, or they dread it or whatever the case may be. You is mind over matter. You've heard that before. So you have to change your mindset, because believe it or not, if you go in with exercising with the wrong mindset, but sometimes you can not want to, but once you get started and get going, and once you're done, you feel a lot better. You're glad you pressed your way and went ahead and did it. But if you have what I call a bad attitude the whole time, and having a begrudging attitude the whole time, you're defeating the purpose, because now your body, listen to this. This is deep. Listen to this. Remember, I said your mindset. When you have a bad attitude, a bad mind, bad thoughts, it make brain cells to release those chemicals, right? So when you start trying to exercise, your body is trying to release the good chemicals. So the bad mindset and the good chemicals are warring against each other. Most oftentimes, guess who will win out? The mind, the brain does. So you have to make sure that your attitude and behavior, self-talk helps. Confession. So you got to have your mind, your heart, and your body to line up to get the results and manifestation of what you want health wise. Okay. So make it fun. Get an accountability partner, somebody at work, a friend, somebody. I have a accountability partner. She kind of travels a lot. Her name is Ann. And hey, Ann. But we try to make sure that we hold each other accountable, not only with working out, with our eating and everything else in regards to our health. So make it fun, have an accountability partner. Again, I want to put a shout out there. We want to do a 30-day challenge for those of you who have been faithful with Medical Monday. I see Maria said she's trying. Maria, we want to do a 30-day challenge. And if you want to be part of that 30-day challenge, you will have a group of people to hold you accountable. So if that is something you guys want to do, yes, Dion, you worship. Yes, worship. Worship helps change your mindset, change your focus. Yes, it does. It does help you get to where you need to be in order for you to be healthy, okay? From the inside out, your spirit man. I just said that to somebody today. One of my patients, when I first met her, I think she weighed like maybe close to over 400 pounds. And now she's down to like, I think she said she's down to I think she's like 190, 200. So she's lost over 200 pounds. And she was talking about today. She said, when you first met me, remember, she was bringing it back to my remembrance, like I really forgot. Bringing it back to my remembrance how she was when I first met her. And today it really blessed my heart to hear her attitude and how she's helping other people with her testimony, and how she's in her word, and how she's praying. And I mean, she's a new woman from the inside out. And I just thank God being part of that journey with her. So I'm so excited I wanted to share that with you guys. So, but her mindset has changed. And so she says she's walking more, and she's able to do things physically that she was not able to do before. So I'm so excited for her. But anyway, how much body movement is required daily? We talked about that. We said at least about 30 minutes. Types of activity. We talk about walking, running, strength training, core training, lifestyle. And for those of you under sound of my voice may not walk, there's chair exercises. There's all things that you could do if your lower extremities are not as strong as they could be and you want to do some cardio. You can do the bikes with your arms. You can do upper body extremity stuff. For those of you who may have things going on with your shoulder, your elbow, your arms, or whatever, you can always do some lower extremity stuff so you can offset some things. There was a study that was released that I wanted to tell you guys about. For you guys that are under the sound of my voice, please share this with your personal trainer, or if you're a personal trainer. We talked about protein pacing. Let me talk about that for a minute before I go into physical activity. Protein pacing is very, very important. Um, it's called 3-2-1, where you do 3 snacks a day, two possibly meal replacements a day, which are protein, and a meal of your choice of anywhere from 400 to 600 calories. Most oftentimes, it should be vegetables, fruit, or whatever the case may be, but it has to be some type of whey protein or plant-based protein that you use, which is called protein pacing. 3 snacks a day. Those 3 snacks a day need to be some form of protein. And you need to have the right amount of protein, and it's based upon your body weight. So there's a formula or equation that we use. If that's something that you're interested in doing, and once we do the 30-day challenge, we're going to share that with those of you who are interested in becoming part of that. Or if you're a personal trainer or a provider, if you want to know what that formula is or whatever the case may be, you can get in touch with us. And I can share that information with you, 248-356-1111. Our email address is bw-center, is it bw-center@info.com. Yes, that's the email address. But go to www.bw-center.com is our email address. Don't forget about the free download, www.bw-center.com/mm for Medical Monday. Hey Dion, if you're interested, let's do the challenge together. Yes, let's do it together. It'll be so much fun. I think we will see as we come together as a team. Yes, Doris. Yes, we could do it as a team, and then we could and share our results and be active. There will be prizes and all that other kind of stuff once you get going and get started. Hey, Apple. Thank you for joining on. Please like, invite, and share. We're talking about a 30-day challenge that I just wanted to see how many people are going to be interested before we get started, because I don't want to start something and there's no interest. But let's get back to what we call activity is called RISE, RISE. Any of your workout should consist of this, and your personal trainer probably is doing this with you. Most personal trainers are very well read. Most of them, some of them are degreed, some of them are not. Some of them are personal trainer based upon the journey that they have gone through. And believe it or not, some of those are the best. But certified trainers, certified personal trainers, those are the ones that you need to be looking for. You need to have RISE is a mnemonic for resistance, interval training, stretching, and endurance. Resistance is some type of resistance, be it weightlifting, be it bands. Bands are band training. I've done that before, and yes, I've seen a lot of different interval training, which means that you bring the heart rate up, try to double it, heart rate up, sometimes triple it. Yes, heart rate up, and then you bring it back down, rest phase, and it's in intervals. And when you do that, it helps burn calories, adipose tissue a lot faster, that visceral fat a lot faster with interval training. Interval training is very, very important. Stretching again is good for toning and defining and decrease injury. And we talked about that. That should be done before workout and after workout. And for those of you yoga fans out there, yoga is very, very key. Believe it or not, yoga origins came from Africa. Yes, even though you see it a lot with association with India, but believe it or not, that yoga original origin is from the continent of Africa. That's a whole nother story. But anyway, endurance. Endurance training is very, very important for those of you that have, like me, I need to do endurance training because my job is it's a physical job. Even though I'm a doctor, I take the doctor's office to people's homes. So yes, I need to do some endurance training to keep my strength in my so I'll be able to do my work day to day, walking up and down hills. Yes, very, very good for that endurance training. Yes, interval training. Yes. Um, Remember that mnemonic. Anytime that you do have a workout regimen, you should have resistance, interval, stretching, and endurance. So those 4 keys that you should have in that. Okay. So for those of you personal trainers out there, most personal trainers do provide not only what you need to do to work out, they should be helping you with your meal planning and possibly with products. Now, for those of you who've been on Medical Money, you guys know that I have a plethora of products. I only have like really 3 that I normally do, and it's from Isagenix is number 1 that I do. They have what they call They have what they call informed sports certification. And what is that? For those of you that are out there that are in professional sports and athletic, where there you have to be monitored and you have to be tested for banned products. Informed Sports is a certification program that regularly tests dietary supplements for banned substances and confirm that they are manufactured under high quality standards. Not only the products are tested, but the manufacturing facilities are tested and assessed to ensure that there's no risk of cross contamination. So that is very, very key for those of you personal trainers that are out there that are recommending products for your professional athletes that may be in bodybuilding or maybe runners or triathlons or whatever they may be doing. You got to make sure that the products that you're recommending are informed sports certified, and Isogenics has that certification. So for those of you who want to know more about that, you can get in touch with me at www.bw-center.com. That is our website. Our telephone number is 248-356-1111. That is very, very important. Message us, Medical Monday, if you want more information. I'm on LinkedIn, Medical Monday. We're on Twitter. We're on all platforms of social media, Medical Monday. So it is very important that you have that certification, okay? Why is proper nutrition very, very important in regards to keeping your body moving? There's a lot of people who think I work out and I can eat whatever I want. No, that's not how that works. Or I could eat this and I'm gonna burn it off tomorrow. That's not how that works. You need to implement proper eating habits at all times. And you guys have been with me, Medical Monday, for quite some time. I don't believe in total deprivation. And Isogenics have some very tasty products that make you not feel like you're missing out on anything. They have this bar that's called Chocolate Decadence. It feels like you're eating a chocolate eclair. They have what they call Iso Chocolates. If for those of you chocolate lovers out there, they have live enzymes in them. So they have the salted caramel, dark chocolate, milk chocolate, mint chocolate. So for those of you out there that like chocolate, we do have a product for that. But anyway, I said all that to say, uh, now at the top of the year, I do a detox. And part of my detox, of course, detoxing and eating right and whatever, I don't I don't detox, and there's different views on this, but this is for me personally. Whoop, you're in my life right now. I personally, when I diabetic products, yes, we could talk about that. I need to do another show about that. Um, Believe it or not, diabetics, your food can be your medicine, but we could talk about that in a minute. But anyway, excuse me. Excuse me. At the top of the year, I did a detox, and so excuse me, I got a little tickle in my throat. And a lot of people have a lot of different beliefs. I don't believe in stressing the body. Detox is already stressful enough. So I don't like to detox and work out at the same time. So I detox, and of course, did a real strict eating regimen. Believe it or not, I released more weight during my detox time than I was when I was working out. You got to remember this too. Um, that when you work out, and especially if you're doing any muscle training or strength training, always remember muscle weighs more than fat. So a lot of people get a little frustrated and feel like that they're not obtaining the goal that they want because they're looking at the numbers on the scale. So what you need to be looking at, and I've said this before, you need to be looking at inches. So your personal trainer, those of you, and you personal trainers should be good at this and are good at this. You need to be doing measuring. Into inches, and how the clothes fit is very, very important. Walking, we talked about walking 30 minutes a day. Walking is very important. Running, for those of you runners out there, there's some people who love to run. That also is interval running. You can incorporate walking with running. That could be part of your hey, Minister Joseph, thank you for joining on. That could be part of your inner training. I just talked about strength training, core training. Core training is very, very important. That is your Pilates, that is your yoga. Your core is basically here, you know, from here, your core, your abdomen, your obliques, and your back muscles is your core. The stronger the core is, the better is everything else. So core training is very, very important. And for those of you under the sound of my voice, I might need to just do a show on just core training, strength training, if that's something you guys are interested in, especially you professional trainers out there. I'm quite sure that you implement and incorporate that in your workout with your people. So it's very, very important that you do that. This should be a lifestyle. I know some of us have goals, weight goals that we want to obtain and things of that nature, but this should be a lifestyle. It should not be, I'm going to meet my goal and then go back to my old habits that got made, choices that I made to get me to that point. No, it should be a lifestyle change. And I try to say this at every show, that it should be a lifestyle change. It should just not be I call it a one hit wonder, right? Chair exercise. Okay. A lot of people are like, what is that really going to do? Let me tell you this. It says here, yes, body been stiff. Good. That means you've been working out, Sharon. So chair exercise. Now, I'm kind of dating myself, but that's all right. Uh, there is this man that's called Jack LaLanne, and you guys remember him on television. I remember watching it with my mother, and she used to do those little chair exercises with him and everything. Jack LaLanne, I think he's still alive, but those chair exercises and all that other kind of stuff, I'm quite sure he did some weight training too, but those chair exercises really work. My mom is 82 years old, and I will call her every morning, and she will say, I just read my scriptures and I did my exercises. And those exercises is those little chair exercises. And my mom has challenges in her body because she has scoliosis since a child, and she has victory every day over her rheumatism. I shouldn't say over her rheumatism, over the rheumatism, I should say. And so she does her exercises regardless to if she's in pain or not in pain. She does her exercises every day. So chair exercises is very, very important. So those of you that are under the sound of my voice, even if you have a desk job where you're at the desk or a computer a lot, you can do chair exercises. And just go online. Just pick up. Hey, Tina. Thank you for joining on. Please like, invite, and share. My sister, that's my real sister, my blood sister. Hey, Tina, I appreciate you joining on. I just got finished talking to Sharon about mom, about how mom does her exercise, her chair exercises. How chair exercises are very important. How mom does those every morning, and how they really make a difference in her day to day and her longevity. How about that? So please like, invite, and share as you guys come on. What I talked about informed sports certification. For those of you athletes that are out there and sports trainers or personal trainers out there, you need to be using products that has that certification. Okay, why protein is important as we mature. It has been scientifically proven as we get younger and younger, or as we mature, our body mass index changes. Our changes, and our body mass changes in regards to increase adipose tissue and decrease muscle mass. So as we mature, weight training is very, very important. Strength training, those band training that I talked about, resistance training is very, very important to maintain that muscle mass. And the stronger a person is as they mature, it decreases the risk of falls and it decreases the risk of injury. So it is very, very important that we keep moving. And let me go back to being incorporated in a lifestyle. And I've shared this with you guys before. Um, Come a little closer. Let me tell you something. Come a little closer. You don't have to always get the closest parking spot to the door. I know we always try to park close to wherever we are. The further away you park and the further you have to walk, guess what? That is a lifestyle. This was something else that I do too. Sometimes I grab buggies because you know how some people are. They take their buggies out and they leave them out. And sometimes when I go to the grocery store or go to one of my favorite drugstores, the buggies be out and I gather them up. And the clerks and whatever, they be like, "You so nice." But I'm saying to myself, I know I'm nice, but I'm doing it for my own selfish reasons. I'm burning extra calories by going to get the carts for you. But anyway, so only when it is cold. No, I do it when it's cold too. For those of you that go to Great Faith Ministries, know that Dr. Grace probably is one of the people that parked the furthest than anybody, rain, sleet, or snow. So I park far so I can walk far. And then you guys know that our church is so long. Hey, Chosen Earl, thank you for getting on. Please like, invite, and share. I do that on purpose. I park that far. And then once you get inside the church is like a whole city block to get to my seat. So I'm getting my exercise in every Sabbath. So yes, hey Sharon, please like, invite, and share as you come on. So, and believe it or not, when it's cold like this, you are burning extra calories because your body needs to maintain its core temperature. So when it's cold like this, it's been a little bit colder longer. It's April and we're still in the 30s, and you know, so being that it's cold, you're burning extra calories. So look at we always try to say, oh, the weather is bad or whatever. There is an upside to it still being cold. So yes, you're burning extra calories to keep warm. Body activity is important for pain management, blood pressure, and mood elevation in regards to stress and depression. Pain management. I was just telling you about my own mom, how she does her daily exercises, and I do believe, even though she may have at times bouts and flares with her pain, when she isn't get to a point where her pain is where the pain is unbearable or whatever, she'll call me and we're like, "Could you please set up physical therapy in the home?" And when I do that for her, she's able, "Hey, Brother Green," she sees a difference. And I do that for I also do pain management with the patients that I have that has a diagnosis of chronic pain. I tell them, hey, you can't just do a script. You got to do other things to manage. And being mobile and moving around helps with that. So, laying around all the time or sitting down all the time, your joints can get, comfortable. Or I've had patients. I've told them they need to get up and move around and not be in a. And I've had people who have what they have contractures. They get contracted in that position, and that increases pain. So no, you can't do that. You got to keep moving. For those that are bed bound, even though they're bed bound, physical therapy, a physical therapist can come into the home and keep them mobile and keep them moving. You should too if you're a caregiver for someone that is bed bound. You need to keep those joints moving and keep them moving, so they won't get contractures and stuff like that. So keeping your body moving is very, very important for that. Blood pressure. Now, blood pressure, I hear this all the time. My blood pressure is high, and or sometimes I get called from physical therapists. We can't do physical therapy today because their blood pressure is high. Blah blah blah. Believe it or not, physical activity, getting that circulation, that vasodilation going. As long as they're not symptomatic, which means they're complaining of chest pain or shortness of breath, of course you don't want to do physical therapy with that. But if they don't have any signs and symptoms, believe it or not, walking or mild exercise can help bring the blood pressure down. That is very, very important that you guys understand and know and recognize and realize that keeping your body moving helps with a whole myriad of things. So remember, I said to you guys, a lot of things to our convenience may not be to our benefit. So we drive everywhere. We're the motor city. So when driving all the time, going everywhere, even our children being bused to school. I used to have to walk to school. I went to Quarry Elementary. It was like 8 blocks away. And then they walked us to Cook, which was a 12 blocks away. So we had to walk to school. And so there was no, my mother my mother didn't pick us up and drop us off. We walked, yes. So so Nowadays, children are being picked up and dropped off, and I know it's for safety issues and all of that because of the times and stuff that we're living in right now. But we also need to incorporate and teach our children. The younger you teach them now, for physical activity, with TV, um, video games, computers, iPads, tablets, all that other kind of stuff. We need to have a time where that stuff is shut down and the children need to go outside and play. Supervised play, okay? Um, I remember we used to have every game, every toy. We used to have big wheels. We used to have bikes. We used to play badminton. We used to have those. We used to play. We used to play. Uh, Cowboys and Indians. We used to make our own little guns with the board and the closing pins with the nail and the rubber bands and the caps, and we would run and chase after each other, play two square. We used to, yes, we used to. I mean, we would be outside playing from the time the sun came up until the street lights came on. Where is that today? We got to keep teach our children to enjoy life and have fun, play, walk, whatever the case may be. And most oftentimes, children mimic or implement their parents. So, parents, the more active you are, the more active your children will be. I remember sharing this with you guys before, and this is kind of like the same parallel. So, humor me for a moment. I told you at the age of 12 months, we should be testing our children for cholesterol. And I remember when I was doing pediatrics in an inner city, that that some children will have very, very high cholesterol. So that's an indication of what their parents are eating. So the same thing with exercise and being mobile. So if the children are not mobile and exercising, 9 times out of 10, the parents are not either. So you can go to a track now. A lot of schools have tracks. You can go to parks now on Sundays after church, or Sabbath after church, or whatever the case may be. Try to go out and do things. Walk the mall. Whatever the case may be, you gotta teach your children very young now that being mobile and being active is very, very important. Let's talk about mood and elevation and stress. Yes. hmm Keeping your body moving and exercising helps release. You remember that cortisol I told you? It helps release what we call endorphins, which are the chemicals in the body that make you feel good, that make you happy. If you're laying around all the time, you're not releasing those endorphins. If you're laying around all the time, your endorphins are low, and those bad chemicals are being released, or you're not producing the serotonin that you need. Okay, the serotonin that you need to make you feel good and make you feel happy, that's those are not being released because a person may be lying around entirely too much, or sedentary, sitting around too much. And then people can have bad attitudes. They don't want to be bothered, they want to be isolated. All of that goes together with lack of body movement. So then guess what? The lack of body movement, and then that mood sets in. And then when that mood sets in and you're sitting around and not doing anything, disease sets in. A person gains weight, and then they depressed about gaining the weight, and then they eat comfort food to make them feel better, and then it's just like a vicious cycle. So keeping your body moving is very, very important. You don't have to. We're all athletic. I mean, start where you are. If you could only walk five, I think I don't know if I shared this story before, but I'm gonna share this story with you. Um, I had a patient. She was overweight. She was morbidly obese. Her blood pressure I couldn't get controlled. I don't think she was diabetic, but I think it was her blood pressure. And she was like, she stayed on the computer a lot, and I was like, she was like, she liked to nibble, she liked to snack, and we identified what her snacks were. So we made a deal. I said, I'll see you in 4 weeks or 30 days. I said, so I want you to do two things for me. I said, after 6 o'clock, if you decide to snack, let it be something healthy, be it fruit, be it vegetables, or whatever. And I said, and then after you eat dinner, I want you to walk to the corner and back. Now, her house could have been on the corner. I don't know. But she said she would do it. Do you believe? Listen, and this is a true story. I am not making this up. She came back in 30 days, and her blood pressure before. And I said, I want to do this before we start your medication. She came back, and her blood pressure was controlled, and she lost 15 pounds by just doing those two things. So those of you that are under the sound of my voice, you know what you are doing that you should not be doing. So you need to make a love yourself enough to say that I'm gonna. Hey, Kenyatta, thank you for joining on. You need to love yourself enough to say, hey, I'm just gonna do two things, stop two things that I know that I should not be doing, or should do one thing that I should not doing and incorporate something that I know I'm not doing that I should be doing. How about that? Hey, Catherine, thank you for joining on. So those of you under the sound of my voice, be it potato chips, be it pop, be it cake, be it whatever your body is craving or whatever, salt, whatever you're doing that you know that you're not doing, that you feel guilty about after you do it, you need to stop it. Okay. And then let me tell you this, if you can't do it cold turkey, cut down. And how about this? When you go to the grocery store and you know it's not something that you should not have, don't buy it. Don't take it, bring it in the house. If it's not in the house, guess what? You won't be tempted to eat it if it's not in the house. And as cold as it's been here in Michigan, for those of you Michiganders here, you're not gonna get up and put on a coat and get out in your car and go drive and go get it. You're gonna be like, it's too cold. So, junk food, yes, junk food. Don't buy it. Don't buy it. Don't put it in the house. So if it's not in the house, you can't be tempted. Okay, so don't do that. All right. And so incorporate something that you know that you need to be doing. Um, Walking, whatever the case may be. One of the things I can't say this now. I'm gonna let you in my life again. I'm kind of like an I love Netflix, and I kind of like Netflix and all the Hulus and stuff like that because they don't have commercials, or most of the commercials are not about food. For those of you that watch TV, regular TV with old school commercials, one one day me and my mom was watching television, and she like her westerns and stuff like that. So we sat there and counted the commercials. It was 15 commercials in a row, and majority of them were about food. So think about it. If you're watching a lot of regular television with commercials and you're watching something that's about food, now mind you, a 30-minute show is only really about 15 minutes and the rest of them are commercials. So 15 commercials after one scene of a show, and it's 15, and it's about food, and you're looking about food. Now remember what we said about your mind. Remember that? Remember we said about mind? And so if your mind if your mind is have 60 to 65,000 thoughts a day, 85% of them are, negative, 95% of them are repetitive, and it's mostly negative stuff. And then you're looking at food, and most of it is junk food. It's those about tacos, it's about hamburgers, about French fries, and you're looking about that over and over and over again. You're gonna want it. So doing commercial breaks, maybe you should just get up and not watch the commercials or channel surf. I don't know, but you should not indoctrinate your mind, your eye gates, your ear gates with things that you know that is not healthy or good for you. Okay, it's 8:51. Catherine Queen. So get your body moving. Okay. Let me tell you about this. We do it like I told you guys about our concierge services. Most of you guys know I say this every show. If you want to have 45 minutes uninterrupted time with me, you can go to our they'll put a link bit.ly/ Dr. Concierge. You can click on that, schedule some time. The time is only is 45 minutes. Pay $75. The $75 go towards any testing that you choose. The vitamin testing on a neurotransmitter testing, you can go towards that. Tonight on the download, www.bw-center.com/MM Medical Monday is a free download. It talks about everything that I talked about you becoming the inner athlete that you can be. and incorporating, making it a lifestyle, making it fun, having accountability. For those of you under the sound of my voice who are interested in that 30-day challenge, please message us at Medical Monday so we can start collecting your names so we can get in touch with you on a start date and a start time, okay? We want to talk about there's an athletic pack that we're offering tonight for those of you that are interested in that in just becoming the best you that you can be from the inside out. Personal trainers, professional athletes. Again, we said that it is what we call um, um, sports certified, informed sports certification that you need to make sure that there's no ban and the products are in the products. What's in the products is on the label, because you guys got to remember most products that are food and it's mostly supplements are not what we call FDA regulated, Food Drug Administration regulated. So a lot of times they can put stuff that's on the outside of the box that's really not inside of the box, and then you put it inside of your body, and that's a problem. So the products that we offer at Isogenics, yes, they are informed sports certification. That is a huge, huge certification, especially for those of you that are out there under the sound of my voice that are in some type of sports activity, professional or being semi-professional or just day to day walking and whatever. Hi, Tasha. Thank you for joining. Please like, invite, and share. We're almost done. Please catch this video from the beginning. Please, Tasha. We talked about protein pacing. Um, um, so go to www. Oh, let me talk about the AMP NOx. It is part of Isogenics, and it is marketed as a sports enhancer. Okay, let me tell you about that. But it's a nitric oxide product. And what oxide it calls, this is a person's blood vessels. So when nitric oxide touches the blood vessels open up and increases circulation, right? So what happens when a person has high blood pressure? Their blood vessels clamp down. So when your blood vessels are exposed to nitric oxide, they expand. So being that it's a natural supplement, we can't say that any supplement that we recommend or whatever that is natural, we can't say that it diagnoses, prevents, or treats, but we can tell you how it works. So even though it is marketed as a sports enhancer to increase endurance while a person is working out, we can tell you how it works, and you can take it from there. Yes. So we're also have that at the www.bw-center.com/mm for Medical Monday, because some of you under the sound of my voice are having challenges with your blood with blood pressure, hypertension, have a diagnosis of it or recently being diagnosed, and you want to know what you can do about it in regards to doing something natural instead of taking medication. I do believe that if this is something that you need to do, you need to let your doctor know that this is something that you're choosing to do. Hey, Tesla, thank you for joining on. And hey, Janice, thank you for joining on. Please like, invite, and share if this is something that you want to do, because this is a true story too. A good friend of mine, husband, she was like, Grace, I don't know why his blood pressure is so low. We're concerned. His blood pressure has been running really, really, really low. We had to go to the emergency room and da 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 da. So one day we were talking, and she was telling me that she was making his shakes and putting the nitric oxide in his shake along with his blood pressure medication. And I was like, you can't do that. And she was like, well, so I explained to her how the nitric oxide works. So when you have vasoconstriction or high blood pressure, when you're exposed to nitric oxide, those blood vessels open up, and when they open up, blood pressure goes down. So if this is something that you're interested in, you can reach us. You can get in touch with us. We can tell you how to get the product. But you definitely, if you're under doctor's care, you got to let your doctor know what you're doing, because they had to wind up weaning him off his blood pressure medication to get his blood pressure up a little bit, because the nitric oxide, the AMP NOx was working. So again, I'm Dr. Grace. It's 8:57. We have 3 more minutes. We talked about tonight about being active and start where you are. Um, let's be honest. When you see all those workout shows or at the beginning of the year, those sports clubs, you know the name of those people out there. They have you see all these skinny people jumping around and all that kind of stuff. And those of us who are not that skinny, you're like, I ain't gonna be doing all of that. And then some of us under the sound of my voice, um, how can I say this? Don't feel comfortable in the weight that they are. So they don't want to go to the gym because they feel not comfortable in their own skin. Let me tell you this. Be it a size 2 or size 22, you're fearfully and wonderfully made, and you have to learn how to love you where you are right now. Because let me tell you this, all this information. I could tell you, and I could hold your hand and tell you need to do this and you need to do that. But if you don't love yourself enough, all this information means nothing because you will not have the discipline to adhere to it, to make a lifestyle change and stick to it for the rest of your life. You have to love you where you are. Like I said, size 2 to whatever. You got to love you enough so you can be comfortable enough to get out there and walk and be like, I don't care who looking. With me with all this junk in my truck, I don't care. I'm out here. I love myself enough to be out here walking, and I don't care who's looking. I'm out here doing what I'm supposed to do, or I'm at the gym, whatever size I am. I love myself enough to be in the gym. I love myself enough to be out walking. Hey, Lenora, thank you for joining on. Please like, invite, and share. I love myself enough to make sure that I eat what I'm supposed to eat. Hey, Laquata, thank you for joining. Please like, invite, and share. You love yourself. You love yourself enough to do what is necessary to take this information to discipline yourself. So those of you that are under the sound of my voice, I decree and declare by the power of my words in the name of Jesus that you love yourself enough to be disciplined to do what you need to do, to have the health that you need to have, to be the right weight, to be the best you that you can be, the best healthiest you that you can be. But it has to start with a mindset and self-love. Yes, mind, self, set, and self love. You have to love yourself enough because once you love yourself enough, you have the discipline to stick to it. So remember when I say food does two things, either it adds to your life or take away from it. It either adds to your life or take away from it. Simple as that. And if you love yourself enough, you're going to eat the food that's going to add to your life. You're going to be like, you know what? I'm not going to eat that. I love me enough to, I love myself enough for me to not, for me not to do that. Or, I heard someone say today that they wanted to be around long enough for their grandchildren and, and this and that and the other. And that was the lady that I was telling you about when I first met her. She was like 400 pounds. And she was talking this way. And when I first met her, she was not even talking about her grandchildren. She wasn't even talking about her family. She was not even talking about herself and doing the things that she needs to do. But now she realized her purpose and yes, Holy Spirit, I hear you. Her purpose and what she needs to do to be the best she that she can be. I know a lot of you that are in the sound of my voice, um, a lot of you are saying, I don't know my purpose. What am I supposed to be doing? Your purpose, number one, is to love God and ask him to show you how to love you. And once you learn how to love you, then you will understand your purpose will be unfold to you. And a lot of people are like, well, how do I find my purpose? Your purpose is in self-love. Love thy neighbor as thyself. So your purpose, most people think, what is my purpose is like, I know I need to be doing something to impact the world. I know I need to be doing something in ministry. And serving people, you have to love people. But you can't love people if you don't love yourself. Let's just be real. Because that's what it says. It says, love thy neighbor as thyself. That it says, love God with all thy mind, with all thy heart, and with all thy strength, and love thy neighbor as thyself. And those, the law and the commandments, hang on those two things. So you can't really love anybody else until you love yourself first. So all the stuff that I talked about, being athletic, eating, and all that other kind of stuff, self-investment, all of that means nothing, is null and void until you learn how to love yourself first. So, hey Deanna, thank you. I see everybody on. It's 9:02. I went a little bit over. I'm sorry about that. Go to www.bw-center.com/mm for Medical Monday. Please, hey author, thank you for joining on. Please like, invite, and share. And for those of you who are just now coming on, please watch this video from the beginning. I talked about this from the perspective of people just wanting to change their lives and become more athletic. Walking is a sport. Yes, it is. And you can challenge each other. We're going to do a 30-day challenge. Message me if you want to be part of that 30-day challenge group. We would love to have you be part of that. But we want to get enough people on board so we can tell you what you need to do and formulate the group to do that. Please share this video if you are a personal trainer, and believe it or not, if you want to partner with me and what I'm doing, me being an MD and a doctor had credibility to what you're already doing. Not saying that you're not credible already, because most of the personal trainers that I have met are phenomenal, because they really have a heart to help people to attain and achieve the goals that they want. If you are a sports professional, be an athlete, pro, semi-pro, you need to have what we call informed sports certification products, which are tested regularly to make sure that they don't have any banned substances, and the facility where they're being produced are tested, and to make sure whatever is on the label is in the product. So please like, invite, and share this. Please, www.bw-center.com/mm Medical Monday for the free download. You need to go and free download that, please. It's very, very important that you do that. If you want to get in contact with us via phone, 248-356-1111, 248-356-1111. Our website is www.bw-center.com. I am Dr. Grace from the Metro Detroit area. Want you to be the best you that you can be from the inside out. So reach out to us, okay? Message us. We're going to start that 30-day challenge, and we want you to be on board when we start. I mean, it's already the end of April. Maybe May will be a good month for those of you that are interested. We can do that. I want the challenge. Yes, please do it. Okay, when you love God first, then God will teach you how to love yourself. Then you will be able to love others. Oh, that's right. That is so true. So I decree and declare that people learn how to love God, so God will show them how to love themselves. That is so true. I appreciate you guys tuning in for Medical Monday. Next week, going to be another show. I need you guys to tune in every Monday at 8 o'clock. Hopefully, I'm going to try this live stream simultaneously also on Instagram. So for those of you under the sound of my voice, we're on Facebook Live and also on YouTube. And hopefully next week, we will also be on IG. I appreciate you for tuning in. Grace and peace. God bless. Bye for now.